similar discussion. 46 million Americans don't have health insurance, though most do receive some care. How will they be integrated into the healthcare system? And the question is phrased in a number of ways. I'm going to start with Congresswoman Johnson, since she supports public option, and go to Congressman Sessions. But the questions are the following. Where do you stand on government-sponsored public options to compete with health insurance companies? How might a public option work? Why should physicians and the public have any confidence that public option will work? And it goes on to criticize Medicare and Medicaid, and there are a couple of those kinds of questions. So, Congresswoman Johnson, how do you describe the public option and the benefits of it?
The way I would describe public option is offering the persons who are unable to get coverage now have an opportunity to go into a pool and pay for coverage. You can call it anything you want to call it. It doesn't matter to me what it's called. But people that are not being covered by current insurances because of pre-diagnosis or priced out of the market, so many million that we have in Texas that are uninsured, the largest number in the country, and many of them are working people that cannot get insurance, would have a marketplace to go to pay for insurance where the other insurance companies will not cover them. I think that unless we provide an opportunity for people to make sure they have insurance, then we've lost our way in attempting to reform this broken system.
Congressman Sessions.
Well, I would call it socialized medicine because that's exactly what it is. And it comes. I'm sorry?
It's better than nothing.
Well, you said I could call it. People can call it what they choose to, and I will tell you what it is. It is socialized medicine. And every place that it exists across the world, there have been diminished results, there have been increased in less freedom and opportunity for people to make decisions in their own health care. And there have been problems in the country that have to literally tax the stuffings out of their business community and run the business community and the jobs out of their countries in order to pay for health care. Diminished care is exactly what this will result in. It may result in a person having a government plan. I will give that to you. But what it does is it takes away from giving the brightest and the best care to each and every individual. Dr. Ron Anderson, who's here in front of me, runs one of the leading edge healthcare hospitals in this country, and he will tell you that no matter who you are, you have an opportunity to come and be with the very best physician, to utilize the very best of medical technology, and the very best of results would be given to you. That is a system that will be hugely diminished and is expected to diminish in a healthcare that will be run by the government, as opposed to one that would be on technology and centered on the patient's needs. We need to understand that the government option will tax America and lose 4.7 million more jobs. And then I wonder who will pay for the health care.
We're going to go one more round on the public option because this is key. So, Congresswoman Johnson?
Yes, I certainly appreciate Baylor, Parkland, and giving this care. They don't turn people away, but I know that last year, Parkland had $512 million uncompensated care. Now, where is that money going to come from? That is not an option that we should pursue, and that is not socialized medicine. It is because people don't know how to take care of themselves or get sick, and they go to the emergency room, most expensive type of care, and they have no other option because they don't have any insurance. Other hospitals often will tell them to put down $500 or $600 before they will treat them. So they've learned that they go to Parkland or go to Baylor or somewhere they know they will not be turned away when they don't have a penny to pay for it. We want to make sure that everybody has an opportunity to have insurance, no matter what they pay for it, as long as they pay according to what they make, so that it won't be all uncompensated care. We taxpayers pick up that. It's uncalled for. Many of them have insurance that don't cover certain things, or they've already been told they're not gonna do anything about their diabetes or cancer because they already had it. That's where they end up, and that's directly out of the pockets of us taxpayers.
Thank you. Congressman Sessions.
Well, I'd like to go back to the main point that we've been trying to make for 12 years, and that is that I believe that quality health care is important, and we need to have more people who are paying into the system. And when individuals do not have the same opportunities on a tax basis as a person who works for a corporation, there is a disparity. And the disparity that exists means that people do not go and get health care through insurance like they should. If we will change the tax policy and do everything that we can do to encourage people to get health care, then there will be more people that pay into the system. It is expensive when you show up at the hospital and you, as a result of not taking care of yourself. But the model of success that Republicans are trying to say is, we want more and more people to have insurance. We want more and more people to have coverage. We want more and more people to focus on the needs of themselves and their families. And this will not be accomplished through a government option.
How will it be?
I already tried to tell you, Eddie.
I didn't get it.
Well, I'll repeat that then. We need to give everybody the same advantages for paying for their health care that people who work for corporations get. We need to do everything we can do first before we tax the stuffings out of jobs in this country and lose them and take 200 million Americans and make them fit in this other pot. It should be done backwards. We should aim at the problem. We should aim at the people who have chronic illnesses. We should aim at the people who are healthy and be able to allow them to be into a healthcare organization through insurance that would be larger pools, because we changed the tax law, and allow every single or virtually every single American to have an opportunity to take care of their needs, not do the reverse where we take a whole bunch of people and fit them into
Why
a
hasn't
system.
that happened?
Because we're doing as we're doing now. You're stuck on where you are. I've drunk my Kool-Aid on the kind of health care that I believe people ought to have. And if we would just make it a level playing field and go to the tax opportunities, I mean, why wouldn't we want individuals to have the same opportunities that corporations get? I mean, you talk about a pot, when you vote against it every time.
Let's move on. We're not going to make a lot of progress. I don't want to stop the back and forth completely, but I do want people to be mindful that we've got to move along and get a number of issues out on the table that have been raised by people good enough to come this morning. So what I'd like to do now, start with Congressman Sessions and move to the question of health care co-ops, and then we're going to go to costs. And the questions raised is, would health care co-ops, such as those proposed by Senator Kent Conrad, be a viable alternative to a public auction? How would they work? What would be gained or lost?
By the way, thank you for doing a great job today. Eddie